6:19 right now, and a new report shows some good news and bad news when it comes to cancer. It shows a continuing trend toward lower death rates from cancer, but there has been a rise in cancer deaths related to what's called the human papilloma virus, or HPV. Here to talk about this is Dr. Bryan Bell with Providence Cancer Center.
In your opinion, why are we seeing an increase in certain types of cancer, especially those related to HPV?
So HPV is known to cause cancer in organs involved in sex. Specifically, we're talking about cancer involving the base of tongue, which is the part of the tongue that you can't see, and the tonsil or the tonsil region in the back of the throat. Since the cancer-causing effects of HPV infection can take years or even decades to manifest itself, most of these individuals were probably exposed to the virus many years ago before they were diagnosed with head and neck cancer. Okay,
and because it's taken so long to sort of manifest itself, what are some of the symptoms when it finally does?
So for most people with oropharynx cancer, the first symptom is actually often a mass in the neck, because cancer in the base of the tongue or the tonsil region is usually asymptomatic until it gets very large. It's often diagnosed after it metastasizes to the lymph nodes in the neck.
So there's no blood test that can give you an early warning here? You just have to wait until you get a symptom?
That's correct.
Wow.
And we have no screening, national screening effort either.
So what happens if I come to you and apparently I've got this mass in my neck that won't go away and I've got the cancer? What can you guys do?
The silver lining here is that HPV and HPV-driven cancers, head and neck cancers, tend to have a much better prognosis than non-HPV-driven cancers, ones we used to see that were generally associated with smoking and drinking. The trick here is to match the intensity of the treatment with the severity of the disease, or to personalize the cancer therapy. So, for example, since we know that HPV cancer has a better prognosis, we're now de-intensifying the treatment if possible, using minimally invasive surgical techniques like the transoral robotic surgery and lower doses of radiation therapy than we would have in the past. And this is in order to achieve the same cure rate, but with the better quality of life for the patient.
Dr. Bell, before we let you go, anything else you want to say to our listeners about HPV? I'm sure they're going to have more questions.
The silver lining here also is that there is a vaccine for HPV. Currently, the CDC's Advisory Committee on Immunization Practices recommends routine vaccination of girls and boys aged 11 to 12 years. Vaccination is also recommended for women ages 13 through 26 years and men aged 13 through 21 years who are not vaccinated previously.
Dr. Bryan Bell with the Providence Cancer Center here on KXL.